Okay, let's dive in. You ever get that sudden, really gripping stomach ache?
Oh, yeah.
Not the kind you can ignore, I mean the kind that really stops you in your tracks, makes you double over.
Right.
That feeling, that intense pain that comes on fast, that's basically what we're talking about today. It's called acute abdomen.
And it sounds simple,
Yeah,
right? A bad tummy ache. But, medically, acute abdomen is a really serious sign.
hmm,
The sources we're looking at define it as this tense, painful abdomen you find on a physical exam.
tense and painful.
Yeah, and the crucial part is that it can be life-threatening. That's why understanding it is, well, pretty important for everyone.
Totally agree. So we've got some medical info here that really breaks it all down. Consider this your quick but thorough guide. We want to cover the critical bits, what causes it, the signs, how it's managed.
Basically give you a solid handle on it without getting too bogged down.
Exactly. Our mission for this deep dive. So let's start with what's actually happening inside the body. What's going on with an acute abdomen?
So fundamentally, the pain comes from just a few main things happening inside. The info points to four main mechanisms.
Four. Okay.
First, you've got organ distension. So think of an organ stretching out, swelling up.
Okay.
Second is inflammation, the body's response to, injury or infection.
Right.
Then there's traction on the mesentery or the peritoneum. That's kind of like the internal lining and the stuff holding organs in place. If that gets pulled or irritated,
That was
very sensitive.
ouch.
And finally, ischemia,
Mm-hmm.
which is just a lack of blood flow getting to an organ.
Okay, those make sense. But I read something interesting in our notes that the organs themselves aren't always super sensitive.
That's right, yeah. The viscera, the organs, they have fewer nerve endings compared to, say, your skin.
Mm-hmm.
So often a problem needs to be pretty widespread or significant before you feel intense pain.
Hmm.
But there are nerve endings in the bowel wall itself, so localized things there can definitely hurt.
Gotcha. So let's unpack those mechanisms a bit more. Distension. What are some real-world examples of that happening inside?
Sure. A classic one is intestinal obstruction. Something's blocking the path, right? Like a foreign object.
Like when a dog eats a sock.
Exactly. Food and gas back up, the bowel stretches, and because of those fewer nerve endings, significant pain often means significant stretching, which can compromise blood flow fast. Very serious.
Okay.
Another big one is GDV, gastric dilatation volvulus, bloat. The stomach swells and twists. Super dramatic, super urgent.
Heard of that. Terrifying.
It is. And even just ileus, where the intestines sort of stop moving things along properly, that can cause distension and pain too.
Like internal gridlock.
Okay?
And inflammation. How does that cause the pain?
Well, inflammation releases all these chemical irritants, basically, vasoactive substances, and they directly stimulate those nerve endings.
Oh.
Plus the peritoneum, that lining of the whole abdominal cavity, it's packed with nerves, super sensitive to widespread inflammation. So generalized peritonitis is incredibly painful.
Makes sense. Now, this isn't just a belly problem, is it? The info talks about effects all over the body. Let's start with, behavior. What might you actually see?
Yeah, the body shows distress in lots of ways. You might see trembling, not wanting to eat in appetence, maybe vocalizing more, whining, crying.
Right.
Lethargy, just no energy. And even specific postures, like trying to get comfortable. The praying position is a classic one front end down, rear end up.
I've seen pictures of that. Trying to relieve pressure, I guess.
Seems like it, yeah. Amazing how they try to cope. Now, the cardiovascular system, that can take a big hit too.
How so?
Well, severe inflammation, ischemia, maybe sepsis.
Yeah.
That overwhelming infection response, it can all lead to circulatory collapse. Basically shock.
Shock, okay.
The whole system starts failing. The source mentions SIRANDM, systemic inflammatory response syndrome, often precedes sepsis.
Yeah.
It's this body-wide inflammation. And septic shock is the worst stage, really dangerous low blood pressure. It's a whole cascade.
Wow. Sounds incredibly serious. Okay, moving to the GI system itself, since that's often ground zero.
Yeah, the signs there are often what you'd first suspect. Vomiting, diarrhea, and again, not eating.
Pretty standard sick pet signs, almost.
They can be, yeah. But the info also mentions generalized functional ileus. The gut just isn't moving properly, and it specifically calls out pancreatic issues, inflammation, necrosis, abscesses, causing that upper abdominal pain, vomiting, and ileus.
So the pancreas is a key player. Got it.
Mm.
What about the liver and the biliary system? Gallbladder, bile ducts?
They can be involved too. Jaundice, that yellowing can show up, specifically with something called extrahepatic cholestasis,
Meaning?
a blockage of bile flow outside the liver. Could be a gallstone or maybe pancreatitis pressing on the bile duct.
Ah, interconnected.
Exactly. And peritonitis, bile leaking into the abdomen, that's another serious one. The notes also say high bilirubin levels can even be a secondary thing from sepsis. Lots of overlap.
Definitely seems that way. Okay, renal and urologic systems. Kidneys, bladder.
Zytemia is the big word there. Buildup of waste products in the blood. And the info breaks it down nicely. Pre-renal meaning before the kidney. Not enough blood flow getting to the kidneys, maybe from dehydration, shock.
Like the water pressure's too low.
Good analogy. Then there's renal azotemia, the problems in the kidneys,
Yeah.
like infection or kidney failure, and post-renal meaning after the kidney, a blockage downstream.
Like a blocked urethra. Or
Exactly. Or
Yeah.
even a ruptured bladder leaking urine into the abdomen uroperitoneum.
Yikes. Okay, last system mentioned respiratory. How does a belly problem affect breathing?
Well, breathing faster, increased respiratory rate can just be from the pain itself.
Makes sense.
But it can also be the body trying to compensate for metabolic problems like
Yeah.
acid-base imbalances that develop because of what's wrong in the abdomen.
So panting might not just be stress, it could be a sign of something internal.
Precisely. It's quite a ripple effect.
It really is. So who gets this? Is it more common in certain animals?
Well, the notes say both dogs and cats get acute abdomen, but maybe seen a bit more often in dogs. And there are some age links. Younger animals, maybe more likely trauma, intussusceptions, that's where the intestine telescopes into itself, or issues from diet or infection.
Right.
Older animals, sadly, you start thinking more about malignancies, cancers causing these signs.
So that tracks. Any specific breeds or types that are higher risk?
Yeah, a few interesting ones. Male cats and dogs are generally more prone to urethral obstruction, that urinary blockage.
Okay.
And the source specifically mentions male Dalmatians being at higher risk for that because they tend to get urate bladder stones more often.
Huh. Specific.
And German Shepherds with pancreatic atrophy, higher risk of mesenteric volvulus, a twisting of the intestines.
Wow, good to know for owners of those breeds. Now, one risk factor in the notes really jumped out at me. Medications.
Oh, absolutely.
Yeah.
This is a big one. Patients getting corticosteroids and NSAIDs, non-steroidal anti-inflammatories.
Very common drugs.
Extremely common. They have a significantly higher risk of developing GI ulcers and even perforations, a hole in the gut lining.
So a routine medication could actually cause or hide a really serious problem.
Exactly. It's a huge aha moment, really. Always worth discussing side effect risks with the vet, especially if using both types together.
Definitely crucial to remember if your pet's on those. Okay, so how does a vet actually spot this? What are the signs they look for?
Well, the info stresses that signs vary a lot. Depends on the cause, how severe it is. But you look at the history, what the owner noticed, and the physical exam findings.
Let's start with the history. What might an owner see at home?
These are often the first clues, right? Trembling, maybe reluctant to move, not eating or drinking, vomiting, diarrhea, maybe crying or whimpering more.
Yeah.
And those weird postures, belly tucked up, or that praying position we mentioned.
And the vet needs to ask really detailed questions, I gather.
Oh, absolutely.
Eh,
Careful questioning is key to narrow things down. Like if the owner mentions dark, tardy stool melena and the pet's on an NSAID, that points strongly towards a GI bleed, maybe an ulcer.
Putting the pieces together like detective work.
It really is. Then comes the physical exam. What the vet finds.
What are they looking for then?
Obvious abdominal pain when they palpate, for one. Tensing up those belly muscles, they call it splinting. Feeling organs that seem full of gas or fluid. Maybe feeling an actual mass or lump.
Okay.
Fluid buildup in the belly ascites. Fever. Or sometimes actually a low temperature, which can be serious. Fast heart rate, fast breathing.
And that palpation, feeling the abdomen, is key.
For sure. Once they confirm pain, they try to localize it front, middle, back of the abdomen. And a rectal exam is really important too.
Right, gotta check everything.
Gives info on the colon, pelvis, urethra, prostate in males. And you can check the stool for that melena sign right there.
Makes sense. The notes also mention ruling out other pain sources.
Yes, vital. Got to be sure the pain is abdominal. They'll check the kidneys carefully, the spine and the lower back area. Sometimes pain from, say, a slipped disc can make the belly muscles tense up and look like abdominal pain.
Referred pain.
Kind of, yeah. Or guarding that mimics it. And kidney infections can definitely cause pain. That seems abdominal too.
So lots to consider. Okay, let's get into the nitty-gritty, the actual causes. The list looks long.
It is extensive, which just shows how many things can go wrong there. The source material breaks it down by system, which helps.
Okay, let's start with the GI tract, stomach and intestines.
Right. Stomach, you've got gastritis, inflammation, ulcers, perforation, a hole, foreign bodies stuck there, and GDV, or a bloat that emergency twist.
Check. Intestines.
Obstruction again, foreign body, maybe a tumor. Intusception, telescoping, hernias trapping bits of bowel, enteritis, inflammation, ulcers, perforations.
A lot of overlap with the stomach issues.
Yeah. Intestinal rupture can happen after blockage, trauma, ulcers, and then there's vascular compromise, blood supply getting cut off, infarction, mesenteric, volvulus, torsion, all very serious.
Phew, okay. That's just the GI tract. What about the pancreas?
Pancreatitis inflammation is a big one. Also abscesses or ischemia, lack of blood flow. And remember, a swollen pancreas can block the bile duct, leading to jaundice.
Right, the connection there. Liver and biliary system.
Rapid swelling of the liver itself can hurt. Bile duct obstruction, rupture, liver tissue necrosis, all can lead to that bile peritonitis we mentioned. Gallbladder mucosal is kind of a sludge buildup, and liver abscesses are possibilities too.
Okay, spleen.
Splenic torsion, twisting on its blood supply. Masses, blood clots, thrombus, abscesses, those are the main spleen-related causes.
Urinary tract next.
Distension is often the key pain trigger here. Lower urinary tract blockage from tumors, stones, inflammation. Trauma causing rupture of the ureters or bladder. Urethral tears with pelvic fractures.
And that leads to?
Urine leaking into the abdomen, chemical peritonitis. Less common causes are acute kidney infections, kidney failure, kidney or ureter stones.
Reproductive system.
In males, prostatitis or prostate abscesses. In females, pyometra and infected uterus is a major one, especially dangerous if it ruptures, leading to sepsis.
Yeah, heard pyometra is bad news.
Very. Less often, you might see a ruptured pregnant uterus, uterine or ovarian torsion, or even a retained testicle twisting in the abdomen.
Wow. Okay, lastly, abdominal wall and diaphragm problems.
Hernias are the main thing here. Umbilical, inguinal, scrotal, even internal ones. If organs get trapped and the blood supply is cut off, strangulation, that's an emergency. Trauma or birth defects can also cause organs to get trapped or displaced, leading to ischemia.
Man, that list is comprehensive. Really highlights the complexity. Now, we mentioned NSAIDs and steroids as risk factors.
Yeah.
Any others?
Yeah, the notes list a few more key ones. Besides those meds, especially used together.
Right. The ulcer risk.
Eating garbage or just inappropriate food, big risk for pancreatitis. Swallowing of foreign objects, risk for intestinal obstruction, obviously.
Common dog move.
Totally. Abdominal trauma, like getting hit by a car, can cause organ rupture. And having a pre-existing hernia increases the risk of obstruction or strangulation happening within that hernia.
So a lot of things can unfortunately up the chances. Okay, diagnosis. How does the vet actually figure out which of those many causes it is?
It's a process, right? Combining the exam with diagnostic tools. First step is often differential diagnosis, ruling out things that look like abdominal pain but aren't.
Like those back or kidney issues you mentioned.
Exactly. Pain from the kidneys, retroperitoneal space, spine, even diffuse muscle pain. That's why the history and physical exam are so foundational.
Makes sense.
The info even points out parvovirus can look a lot like an intestinal obstruction initially. Need specific tests like a parvo test and blood work to differentiate.
So lab work, blood tests, urinalysis, what do they tell you?
A lot, potentially. CBC, complete blood count, can show signs of inflammation or infection. White blood cell changes. Anemia might mean blood loss, like from a bleeding ulcer. Chemistry panel checks organ function. Azotemia, those waste products, helps assess kidneys, hydration. Electrolyte changes can point to GI issues, like with stomach outflow obstruction or kidney failure, high potassium. Liver enzymes, bilirubin, check the liver and biliary system.
And urine.
Urinalysis, especially checking concentration before fluids, helps figure out why there's azotemia. Looking at the sediment under a microscope can show infection, kidney cell damage, loads of clues in basic labs.
Seems like it. Any other specialized lab tests?
Yeah, a few. Venous blood gas and lactate levels help assess acid-base status and tissue perfusion blood flow.
Yeah.
High lactate can indicate shock.
Right.
And there's that specific test for pancreatic enzymes. Pancreatic lipase immunoreactivity, very useful for diagnosing pancreatitis.
Okay, labs covered. What about looking inside? Imaging.
Crucial. Abdominal x-rays are often a first step. Can show masses, organ size changes, fluid maybe.
Fluid showing up as?
Loss of detail, sort of a hazy look inside. That often prompts getting a fluid sample. Free gas on an x-ray is a big red flag, usually means rupture or gas-producing bacteria. Needs surgery, typically.
Usually.
Well, you gotta be careful. A little air can get in after sampling fluid, or it's normal right after surgery. Context is key. X-rays also show ileus lack of gut movement and can sometimes differentiate functional versus mechanical blockage. And radiopaque foreign bodies, obviously.
Like metal or dense bone.
Exactly. Sometimes contrast X-rays are used giving barium or another agent to outline the GI tract, look for blockages, but not barium if you suspect a perforation. Use iodinated contrast then. X-rays might also show subtle signs suggesting pancreatitis.
So X-rays give a good overview. What about ultrasound?
Ultrasound is really sensitive for lots of things. Masses, fluid collections, abscesses, cysts, enlarged lymph nodes, stones in the gallbladder or urinary tract. Very useful.
And there's that fast scan.
Yeah, focused assessment with sonography and trauma. Quick bedside scan in emergencies, looking specifically for fluid, like blood from trauma.
And CT scans.
Even more sensitive, more detail. Especially useful for surgical planning sometimes.
Okay, imaging covered. What about actually taking samples, abdominal centesis?
Right, tapping the abdomen. Super important. The notes say do it in almost all acute abdomen cases. Often a 4-quadrant tap to increase chances of finding fluid.
Even small amounts.
Yeah, sometimes you can get fluid even if it's not obvious on X-ray. Ultrasound guidance helps, but it can often be done safely without. Analyzing that fluid is key.
What are you looking for in the fluid?
Signs of septic peritonitis infection, high white blood cell count, degenerate neutrophils, bacteria inside the cells. That usually means emergency surgery.
Okay.
Can also compare fluid glucose to blood glucose. A big difference suggests sepsis. Pancreatitis fluid might show inflammation but no bacteria. High creatinine in the fluid points to urine leakage. High bilirubin points to bile leakage. So much info from that fluid.
Wow, it really tells a story. The notes also mention sedation for palpation.
Yeah, because the animal is often painful and tense. Sedating them can relax the abdominal muscles enough for the vet to get a much better feel. Might find a non-radiopaque foreign body or other subtle things missed otherwise.
And last resort, exploratory surgery. Laparotomy.
Sometimes it's needed for diagnosis, yeah. If advanced imaging isn't available or if all the tests are inconclusive but something is clearly very wrong, allows the surgeon to just go in and look directly.
Okay, makes sense. So we've got a potential diagnosis. What's the treatment plan look like?
Well, first thing is appropriate care. Almost always means hospitalization. Supportive care is key initially. Stabilize the patient, then figure out medical management or surgery.
And sometimes surgery needs to happen fast.
Often, yes. Early surgical intervention when it's indicated is really critical for a good outcome. Aggressive therapy, prompt diagnosis, that's the name of the game. And keep them MPO, nothing by mouth if they're vomiting.
Right. 5 fluids are usually essential.
Oh, absolutely. They lose a lot of fluid, one way or another. Goal is restoring blood volume. Start with isotonic crystalloids, like LRS or saline. Specific shock doses for dogs and cats.
And if that's not enough?
Might consider hypertonic saline or colloids if they're refractory to fluids or have really low protein levels.
Yeah.
But you have to monitor hydration, electrolytes really closely and adjust the fluids constantly.
What about nutrition?
Important to start early, if possible. Helps maintain the gut lining. Can be enteral through the GI tract via tube or careful feeding or parenteral, IV nutrition if needed.
And surgery? You mentioned trying to diagnose before surgery if possible.
Yeah, ideally, because so many causes have both medical and surgical options. Getting a definitive diagnosis helps avoid unnecessary surgery, manages owner expectations about prognosis and cost, and lets the surgeon prepare better.
Good point. What about medications? What gets used?
Depends on the cause and signs, of course. Pain control is huge. Usually strong opioids like hydromorphone or fentanyl for severe pain. Acid reducers, H2 blockers like sanloxidine, or proton pump inhibitors like pantoprazole. Gut protectants like sucralfate.
For vomiting.
Antiemetics, yeah. Metoclopramide, but with caution if obstruction is suspected. Meropenem, ondansetron, dolostron, or others.
And antibiotics?
If infection is suspected or confirmed, or if there's hemorrhagic diarrhea. Usually start broad spectrum, covering gram-positives, negatives, anaerobes. Ideally after getting samples for culture, but sometimes you have to start sooner.
Are there meds to definitely avoid?
Well, that caution about metoclopramide if you suspect an obstruction. And definitely no barium contrast. If you suspect a perforation, use iodinated contrast instead.
Got it. Any other precautions with meds?
Yeah, be careful with drugs potentially toxic to the kidneys, like gentamicin or NSAIDs, especially in dehydrated animals or those with existing kidney issues. And for pain, opioids are generally safer than NSAIDs in acute abdomen because of the lower GI risk.
Makes sense. And follow-up care?
It's usually intensive care. Very close monitoring vital signs, repeat blood work to make sure they're responding, and catch any complications early.
Okay. So wrapping up this deep dive, It's crystal clear that acute abdomen is, well, a really serious thing. So many potential causes.
Absolutely. Requires owners to be observant, vets to do thorough diagnostics, and often very timely intervention, including surgery.
And hopefully for you listening, this gives you a much better grasp of what that term acute abdomen actually covers, the internal complexities, the body-wide effects, and why getting that prompt veterinary help is just so critical.
Couldn't agree more. It's not just a wait-and-see kind of situation.
Definitely not. Considering that huge range of causes we discussed, it really drives home how interconnected everything in the body is, doesn't it?
It really does.
So, what does that maybe tell us about how we should approach health and illness, not just in emergencies like this, but maybe more broadly?
It's a good reminder, I think, that the body's this intricate system, and understanding those connections is key to overall well-being.